Accupril is a medication available in tablet form, and its active substance is quinapril hydrochloride. It falls under the category of angiotensin-converting enzyme inhibitors, which work to relax blood vessels and improve blood flow, ultimately helping to lower blood pressure. Indications: Accupril tablets are prescribed for the treatment of hypertension, high blood pressure, and also for improving the survival rate after a heart attack. It can also be used in combination with other medications to treat congestive heart failure. How to use: Accupril tablets are intended for oral administration and can be taken with or without food. The dosage may vary depending on the individual's condition and response to treatment. Always follow your doctor's instructions regarding the dosage. For hypertension, the usual starting dose is 10 to 20 mg once daily, and the maintenance dosage ranges from 20 to 80 mg per day. For heart failure or post-heart attack treatment, the recommended starting dose is 5 mg twice daily. The dose may be increased based on your doctor's evaluation. Contraindications: Don't take Accupril tablets if you're allergic to quinapril or other ACE inhibitors. You have a history of angioedema, a serious allergic reaction associated with ACE inhibitors. You have a history of hereditary or idiopathic angioedema. You are pregnant or planning to become pregnant, as ACE inhibitors can harm the fetus. Precautions: Inform a healthcare provider about all the medications, vitamins, and herbal supplements you are taking before starting Accupril. Accupril may cause dizziness or lightheadedness, especially when starting up from a sitting or lying position. Be cautious when performing activities that require alertness. Don't use salt substitutes or potassium supplements without consulting a doctor, as they may affect your potassium levels while taking Accupril. Side effects: Common side effects of Accupril may include but are not limited to cough, dizziness or lightheadedness, fatigue, headache, upset stomach or diarrhea. Less common but potentially serious side effects may include severe allergic reactions, swelling of the face, lips, tongue or throat, angioedema, elevated blood potassium levels. If you experience any severe or unusual side effects, seek medical attention promptly.